if you're symptomatic, visibly symptomatic, I don't think it should be recommended that you be anywhere. I mean, and the recommendations that we have been making are to be considered. Understand that if you're visibly symptomatic, you are going to be more likely to be infectious. And so you're more likely to be passing on the virus to others. That's one. Um, Two, it also has to do with levels of care that people are going to be able to undertake and keeping track of all those persons that are potentially positive. I think that's a gray area in terms of determining level of safety.
The probability that the more cases will emerge on nomination day and election day is highly probable.
If we are able to adhere to what has been clearly stipulated as a prevention measure, I don't know that that should be a concern. And I expressed that to Elections and Boundaries when I met with them on Wednesday of last week, because I know people are concerned with the touching of the pen or the pencil, the ballot paper, the dipping of your finger in ink. And I was explaining to them where the real risk is. So if people are just able to go in, vote, and go home, and not having these mass congregations anywhere, then I think it should be a pretty safe process and procedure, similar to what should happen on Wednesday.
Okay, so I go back to my original question, taking into consideration what you just said and what you previously said. Is it safe for COVID-19 patients to go on to vote? I asked again because, as you say, you have people out there walking with it. Asymptomatic people, as we speak now, who haven't been detected by the system.
That is correct, and that's why I go back to what I said. If you're visibly symptomatic, you are more than likely to have a higher viral load. Your risk is going to be higher of passing on the virus. But you see, it's the elements of not being able to do that, the elements of people who know they are positive still walking. So it's how you balance that situation. I don't know that we are disciplined enough to be able to keep those principles. The same factors that you see or that you ask that are driving the situation in Ridgewa could be the factors that drive a situation on nomination day or on election day. So if we have not been able to get a good grasp of that, then you can anticipate that something will happen.
With your meeting with the ENB, with the Elections and Boundaries Commission or Department, was it discussed any possibility or any information of any procedures that would allow COVID-19 patients to vote?
No, that we did not reach that discussion.